Hello guys, welcome back to Medico Days. So the volume 2 of the PYQ rapid revision series is out, and the volume 2 will be consisting of anatomy, anesthesia, surgery, ortho, pharmacology, pathology and dermatology. So since it is out, you guys can start inquiring about it by personal message on our Telegram, and from tomorrow onwards you will be getting the notes, the PYQs, PDF. And so guys, start inquiring early now itself. And now this video is about the surgery PYQ, and I have previously discussed about the 2018, 19 and 2020 surgery PYQs. This video will be about the PYQs from 2021 onwards. So the PDF which I'll be publishing, which I'll be giving to the paid members, the video of the same is uploaded in our channel, and until Neetpg it will be free for everyone. After that it will be made private, guys, so please utilize it. If at all you are short of money or you cannot buy it, then everything is available in the YouTube in the video also. But if you have a PDF, it will be easier for you to revise in the last moment. The main purpose of the video and the PDF, even the PDF I've kept at a very nominal price, so that it will enable everyone, most of the people, to get it at an affordable price, and to have to utilize maximum, because PYQs are something which you cannot miss out. If you make a PYQ as a wrong in the exam, then you are out of the competition. That is why I'm trying to provide it at a very affordable rate, and also to help you guys. Please utilize it. And now quickly moving on to the surgery 2021 PYQ. Question number 1: a patient underwent surgery for breast carcinoma and now presents with painless arm swelling. What is the most likely diagnosis? So here from the image you can understand it is a case of lymphedema, and post mastectomy lymphedema is very common, and it results from the lymphatic drainage disruption after the axillary node resection or radiotherapy. And the main features are painless swelling, heaviness and reduced mobility in the ipsilateral arm, and diagnosis is usually clinical, and also imaging can be done. Lymphangiosarcoma is another condition which is also known as Stewart-Travis syndrome, and it is quite rare, and it occurs after chronic lymphedema for more than 10 years, and it presents with bluish red nodules. Venous thrombosis, which is Page-Schroeder syndrome, it presents with painful swelling, and it is usually seen in athletes. Here is an image of Stewart-Travis syndrome, lymphangiosarcoma. Next question: which statement is true about the below image? So this is an image of Fournier's gangrene, which is necrotizing fasciitis of the perineal or the genital tissues, and it is caused by polymicrobial infection, that is mixed aerobic and anaerobic infection. And the features are scrotal pain, crepitus, blackish discoloration, but the testes will be intact. So there is no need of orchidectomy as a treatment option. Management is usually emergency debridement plus broad spectrum antibiotics. Next question: a child presents with sudden dysphagia and has a circular opacity on neck x-ray. So this is a case of esophageal foreign body. When there is a coin in a esophagus, it appears as coronal on AP view and sagittal on the lateral view. It is just the opposite in case of coin in trachea. Next one: a 75-year-old with Gleason 6 prostate cancer, PSA less than 10. What is the management? So here the management is active surveillance. Gleason score and PSA values is very important, because prostate cancer, recently 1 to 2 questions keep coming up in Neetpg, so just go through the scoring. Next question: a cystoprostatectomy specimen shown below. What is the diagnosis? Answer is bladder carcinoma. So urology is recently becoming quite a favorite topic in Neetpg, so please go through the urology area little bit. Previously urology was not a much focused area, but nowadays questions are coming up from here. Next question: a stable RTA trauma patient with left lumbar tenderness. What is the best investigation? Answer is contrast CT, that is CECT, which assesses the injury grade, laceration or hematoma, and also rules out non-renal injuries. Next question: the post-op imaging of a rectal prolapse is shown, and what is the procedure performed? So here it is an image of Thiersch wiring. Next question: post-RTA patient with urethral meatal blood and non-palpable bladder is seen, and what is the next step? So here the next step is to wait, because the clinical scenario points at blood at the tip of the urethral meatus following an RTA, and the best management is urethral injury. Best management is to wait and watch. In case of urethral injury, we need to avoid Foley's catheter insertion, because there is a higher risk of tear, and also retrourethrogram is the first imaging technique used here to assess the injury severity before catheterization or any other intervention. And if at all the bladder is full or there is urinary retention, we can also do suprapubic cystostomy. Next question, hernia medial to the inferior epigastric artery. So this is a case of direct hernia, and the treatment used is Listen's repair. If at all it is lateral to the inferior epigastric artery, it becomes indirect hernia, and the direct hernia protrudes through the Hasselbalch's triangle. The boundaries of Hasselbalch's triangle is also important. Please go through that. Next question, unstable RTA patient with subcutaneous emphysema and absent breath sounds. What is the immediate action? So this is a case of tension pneumothorax, and the treatment is needle decompression at the fifth intercostal space, which is to be done first. And then tube thoracostomy can also be done later on after this chest tube insertion, which is the chest tube insertion itself. And another important area in Neetpg is the cardiac tamponade and its management. Tension pneumothorax and cardiac tamponade are very, very favorite trauma related questions every time coming up in Neetpg. Next question, a 54-year-old female with bilious vomiting, abdominal pain and air in the biliary tree. What is the diagnosis? So answer is gallstone ileus, because gallstones erodes into the duodenum via cholecystoenteric fistula and it causes small bowel obstruction. There is a triad known as Wriggler's triad, where there is pneumobilia, small bowel obstruction and ectopic gallstones, which are seen on CT or X-ray. Next question, a patient with abdominal pain and sterile pyuria shows homogeneous renal calcification and the imaging. And what is the diagnosis? So here you can see the image of a putty kidney, and it is pathognomonic for renal TB. And there is sterile pyuria, moth-eaten calyces on IVP and positive urine AFB culture. Next question, gastric antral tumor with pancreatic head and liver mets. What is the management? Answer is palliative gastrojejunostomy plus chemotherapy. Next question, post-cholecystectomy patient after 2 years presents with obstructive jaundice, and what is the type of stone? So here the answer is primary stone, because after 2 years primary stones develop and within 2 years secondary stone develops. Next question, 70-year-old with thigh claudication and iliac artery occlusion on angiography. What is the best surgery? So this from the imaging you can see that this is a case of iliac disease, and which is also known as Lurich syndrome, and the treatment option here is aortofemoral bypass. Next one, young patient with asymptomatic dilated leg veins. What is the CEAP classification? So CEAP classification is again very important. CEAP C2A is the classification here, which is asymptomatic varicose veins. If at all it is symptomatic varicose vein, then it becomes C2S. Next one, alcoholic with peripancreatic fluid on CT. Which enzyme is elevated? So here in acute pancreatitis, lipase levels will be high. Next question, 25-year-old with fever, abdominal pain for 3 days and pneumoperitoneum on X-ray. So here you can see that there is air under the diaphragm, and that points to pneumoperitoneum, and the diagnosis here is hollow viscous perforation. Moving on to Neetpg 2022 surgery PYQs. First one, a 6-year-old boy presents with recurrent UTI. Imaging shows a dilated ureter. What is the diagnosis? So this is an image of a vesicoureteric reflex, which is a congenital condition causing retrograde urine flow from the bladder to the ureter or the kidney, and it leads to recurrent UTI and pyelonephritis. It is diagnosed by micturating cystoureterogram. And next one, a 45-year-old female develops perioral numbness 3 days post-thyroidectomy. What investigation is needed here? So in this case, the answer is calcium, phosphate and PTH, because we are suspecting hypocalcemia because of the hypoparathyroidism. Because when we do the thyroid surgery, there is a high chance of parathyroid gland as well being removed. And so in order to confirm the levels of calcium, phosphate and PTH, we do that testing. And the key signs in hypoparathyroidism are the Trocheus sign and the Chostek sign. In Trocheus sign, there is carpopedal spasm, and Chostek sign, there is facial twitching. Images of these as well, please go through them. And the management here is IV calcium gluconate. Next question, during liver injury repair, coagulation is monitored intraoperatively. What is the method used here? So this is an imaging of thromboelastography, and normal thromboelastography image is given. Also thromboelastography image in use of anticoagulants, hemophilia, platelet blockers, fibrinolysis, hypercoagulation and DIC is also provided. Please go through them. Thromboelastography, recently questions are coming up. Even in Neetpg 2023 there was a question. So check upon that. Next, a 59-year-old female has a painless breast lump with pudgy orange appearance. What causes this? So pudgy orange appearance is because of the infiltration of the subdermal lymphatics. Next question. A child with stab injury and omental evisceration is hemodynamically stable. What is the next step? So here, whenever there is an evisceration, we need to always do emergency laparotomy, and we cannot wait for any other things. Next question. Rupture of a saccular aneurysm most likely causes. It leads to subarachnoid hemorrhage. The saccular or the berry aneurysms, they rupture into the subarachnoid space. That is a circle of Willis, and it leads to thunderclap headache, and thunderclap headache, again a very important feature of the subarachnoid hemorrhage. Next question. Sudden right leg pain with triphasic arterial waveform on imaging. Which test is done? So this imaging is of an ultrasound Doppler, and the triphasic waveform is normal on the Doppler ultrasound. That is systolic peak plus the diastolic reversal plus the forward flow, which are seen in the triphasic form. Next question. A nasolabial fold nodule with peripheral palisading on histopathology image is given. What is the diagnosis? So here, peripheral palisading and pearly nodules and are seen in cases of nasolabial fold. All this points towards basal cell carcinoma. Next question. A 45-year-old with neck pain worsening on eating and Wharton's duct on ultrasound. What is the diagnosis? So this here you can see that there is an opacity seen in the ultrasound, and that points to silolithiasis. Next question. Delayed IV urogram shows hydronephrosis without uretral contrast. What is the diagnosis? So here you can see pelviureteric junction obstruction. Next question. A young male with a motor vehicle accident cannot pass urine and has blood at the meatus. What is the most likely site of the urethral injury? So here this is an image of the membranous urethral rupture. You need to also see images of bulbar urethra and penile urethral rupture as well, and the features of each of them, because urethral injury and its features are a trending question. Every year one question will be there. So please don't forget to check up on that. Next, a patient presents with midline neck swelling and cervical lymphadenopathy, and the HPE shows orphan Annie nuclei. And so whenever orphan Annie nuclei comes up, it is a case of papillary carcinoma. And what is false? Answer: FNAC is not diagnostic. That is wrong, because FNAC is the diagnostic one. FNAC is not a diagnostic option in case of follicular carcinoma of thyroid. Next question. A 40-year-old hypertensive man with hematuria, loin pain and a family history of stroke has cystic kidneys on USG. What is the diagnosis? So this is a case of ADPKD because he is an adult. So ADPKD is more common in children. ARPKD is more common. Next question. A patient with acute abdominal pain and air under the diaphragm on chest x-ray. What is the next step? So pneumoperitoneum is a very urgent condition, and we need to do emergency laparotomy here. Next question. A preschool child has burns involving the right arm, chest, abdomen and thighs. Calculate the burn percentage. So London-Browder chart and the rule of 9, you need to learn both of these. It's quite difficult, but yes, you have to learn, because recently questions are coming up from these areas. In this question, the answer is 25 to 30%. I've mentioned the chart here. Please go through this. Next question. A 32-year-old alcoholic with oral cancer and burning sensation has white oral lesions. What is the diagnosis? So white oral lesions and alcoholic patient, it mostly points towards leukoplakia. Next question. A patient has a tender pulsatile neck mass. What is the next step? So here the next step is ultrasound Doppler, because a pulsatile mass suggests a vascular anomaly. It can be an aneurysm, hemangioma or anything. So the next step is ultrasound Doppler. Next question. Prostate cancer spreads to the lumbar vertebra via which route? It is through the prostatic venous plexus, which is also known as the Batson's venous plexus. Next question. A male with impotence, bilateral resting pain and gangrenous toes. What is the pathology? It is a case of ioto-iliac bifurcation, that is the Leret syndrome. And Leret syndrome, again a favorite question. Please go through that. Next, and again a favorite question, a PYQ again. Previously we have discussed also about this. That is, it is of the Fournier's gangrene. A male with sudden scrotal pain, discharge and blackish discoloration. What is the diagnosis? Here it is an image of Fournier's gangrene. Next, identify the IV fluid. So the composition of the IV fluid is given, which consists of sodium lactate, sodium chloride, potassium, calcium, and this is ringalactate. It is also known as Hardman solution. It is used for resuscitation, metabolic acidosis and burns. Next is a pressure sore with muscle layer destruction, and this is stage 4. The different stages of bed sores are very, very important. Please go through them. So stage 1, there is erythema with no blanching and no breach in the epidermis. Stage 2 has partial partial thickness skin loss. Stage 3 has full thickness skin loss with intact fascia but involvement of subcutaneous tissue, and stage 4 has full thickness skin loss extending into the fascia with tissue destruction, involvement of muscle, bone, tendon or joint. And what is the most common site of intra-abdominal abscess? Answer is right subhepatic space. It is the most common site of intra-abdominal abscess. Next question, recurrent anal discharge with perianal lesions. What is the diagnosis? So this is a case of a fistula in ano, and Goodsall's rule is important in predicting the internal opening location in case of fistula in ano. Next question, which triage category includes ambulatory patient? So triage, again an important area, red, yellow, green and black, in which all conditions we triage the people into red category, yellow, green and black, and what is the treatment is also important. Please go through them. Next, moving on to the Neetpg surgery 2023 PYQs. Question number 1, a 55-year-old male presented with verrucous carcinoma around the glans of the penis. An examination reveals that the inguinal lymph nodes are not enlarged. What is the management? So here you can do a partial penectomy, because verrucous carcinoma involving the glans penis is usually managed like that. Total penectomy is used only for tumors where the residual stump would be less than 2 centimeters. So CO2 laser and 5-fluorouracil are used for penile intraepithelial neoplasia. Next one, identify the procedure being performed in the given image. So this is an image of intraosseous root access for giving IV fluids. It is used when the IV access is difficult. Next question, again a repeat question. A diabetic patient presents with sudden onset perineal pain, foul smelling discharge and necrotic tissue, which is true about the given condition. So this is a case of Fournier's gangrene and caused by mixed aerobic and anaerobic infection. The same exact question had come previously also. Next, which of the following is the most common complication following ligation of the first vessel during abdominoperineal resection for rectal carcinoma? So in order to have an idea about this question, you need to read a little in depth about the rectal carcinoma. In this case, the answer is sympathetic, and it leads to retrograde ejaculation and bladder dysfunction. Next question, a patient presents with a chest lesion following trauma 1 year ago. What is the most likely diagnosis? So this is a case of keloid, which occurs because of excess collagen extending beyond the wound boundaries, and the hypertrophic scar, they usually are confined to the injury site and they won't extend beyond the wound boundaries. Next, a 45-year-old male underwent bilateral laparoscopic hernia repair and complains of right thigh pain postoperatively. Which nerve entrapment leads to this symptom? So answer is lateral cutaneous nerve of thigh, because it causes meralgia paresthetica, that is pain or numbness in the thigh. Next question, a patient was brought to emergency room following an RTA. On examination, patient opens his eyes to painful stimulus, speaks inappropriately and withdraws his limbs to painful stimulus. What is the Glasgow Coma Scale score? GCS score, very very important question. Everyone, 99% of the people will be making, the toppers will be making it correct. If you want to get into a government seat, into a good seat at least, you cannot make the GCS score wrong. It is like a very easy topic and very important topic. Everyone will be making it correct. Please don't miss out on questions like this. GCS, very important, learn about it. Next, a liver cyst with serpentine membranes is seen on CT. Which statement is true? So this is a case of Echinococcus species causing hydatid cyst, and it shows serpentine membranes on imaging. The other stages of the Echinococcus is also, and their imaging is also important. Please go through them. Next, a 40-year-old male with a slow growing mobile neck swelling. What is the diagnosis? This again was a PYQ, and here the answer is parotid tumor. And the pleomorphic adenoma, which presents as a slow-growing mobile mass, is the benign parotid tumor, is the answer here. Next question, a patient with alcohol dependence came with sudden weight loss and AFP 600, ALP 240, and AST by ALT 0.5, and direct bilirubin of 1 mg per deciliter. What is the answer here? So this is a case of hepatocellular carcinoma, because there is elevated AFP levels. Next one, chronic pancreatitis with dilated pancreatic duct and calculi. What is the surgery of choice? Answer is longitudinal pancreatico-jejunostomy. And Puster's procedure, which is the procedure which drains the obstructed duct, and ERCP is for ductal stones without dilation. Next question, a BIRATS 5 breast lesion. So BIRATS scoring again very important. BIRATS, TIRADS, all these scoring are very important, guys, because questions keep coming up from them. What is the good prognostic factor here? Answer is ER positivity, because ER positivity indicates hormone responsiveness. So there is better chance of prognosis. Next question, chest pain with BP discrepancy and widened mediastinum. What is the diagnosis? It is a case of acute aortic dissection, because there is BP discrepancy and also widened mediastinum. These are both features of aortic dissection, and thunderclap headache also is seen here. Next question, liver abscess of 25 cc after diarrhea. Next step of management is medical therapy, because amoebic abscess, they are very common and they are usually treated with metronidazole. Only after that we go into other drainage and other options. Next, confusion and ataxia after trauma in an alcoholic patient is there, and CT shows imaging is given here. What is the diagnosis? So this is an image of subdural hemorrhage, where you can see that there is a concave shaped, a crescent shaped hyperdensity on the CT. Next question, what is false about Melanese gangrene? Hyperbaric oxygen has no role is the false statement, because hyperbaric oxygen is used in the treatment of Melanese gangrene. Next question, direct inguinal hernia is caused by weakness in the, answer is conjoint tendon. So the ligaments and conjoint tendon, the muscles, all of these related to the inguinal canal are very important. The deep inguinal ring, superficial inguinal ring, the boundaries, and all these are very important. Please go through them. And next one, hematemesis in a patient taking aspirin. What is the diagnosis? It is because of peptic ulcer, because NSAIDs are a very important cause of peptic ulcer. Next question, white fingers in a construction worker is because of, answer is because of vibrating tools. In Raynaud's phenomenon is usually related to this vibrating tool usage, and so white fingers can happen. Next, a child with rectal mass and mucin filled glands. What is the diagnosis? So it is a case of hematoma, because juvenile polyps are usually hematomatous. And next question, identify the given condition. So this is an image of a trophic ulcer, different types of ulcers and different types of edges seen in which conditions. All these are very important. Please go through them. Next question, a patient comes to casualty with a severe headache. His BP was found to be 160/100. CT shows the subarachnoid hemorrhage. Next best step in the management is, answer is angiography, because angiography locates the aneurysm after subarachnoid hemorrhage confirmation, and surgery is done after angiography. Definitive treatment follows angiography, but it is not the immediate step after CT confirmation. Next, varicose vein with eczema, CAP classification. Again, a favorite question, CAP classification. Please go through them. So here, this is a case of C4A stage. I mentioned all the stages here. Please go through them, guys. Very important question. Next, corrosive NaOH ingestion is seen by a patient, and the patient now presents with dysphagia. What is the management? So here the management is feeding jejunostomy, because enteral nutrition, it ensures the enteral nutrition during the stages of esophageal healing. Next one, midline neck swelling which moves with deglutition and tongue protrusion. What is the diagnosis? So movement with tongue protrusion is seen in case of thyroglossal cyst. Next question, a 54-year-old woman presents with cervical cancer stage 2A. It is decided to give neoadjuvant chemotherapy. What does neoadjuvant chemotherapy mean? So neoadjuvant is means that it is given, chemotherapy is given before the surgery itself. Next question, Q4 SOFA score components. So the components are SBP, respiratory rate, and Glasgow Coma scale. And I've made a comparison table of the SIRS, QSOFA, Muse, and New scoring system and the components. Please go through that. Now that's it, guys, for this video. So I'll be coming up with my next video where I'll be discussing about the Neetpg surgery 2024 PYQs. And till I come back with my new video, stay tuned. Also, don't forget to check out my volume 2, which is out now, and you can buy it all, guys. So till I come back, stay tuned. Bye bye.